Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. A 5-minute test could be a faster way to screen people for dementia. A new 5-minute test could make screening for cognitive decline much easier for primary care providers, PCPs. /r/n/r/n. The test, which can be embedded into an electronic medical record, EMR, may help providers determine if more tests or referrals are needed for patients who are showing signs of cognitive impairment. This step could be crucial for closing the gap in the underdiagnosis of dementia, especially in lower-income populations. /r/n/r/n. The researchers studied the 5-cog paradigm test with more than 1,000 older adults living in socially disadvantaged neighborhoods in the Bronx, New York. The adults were all at least 65 years old, and 94% were Black, Hispanic, or Latino. All the patients had expressed cognitive concerns during a visit with a primary care provider. /r/n/r/n. The participants were randomly assigned to be in a group that would take the test or a group that would not. After 90 days, the patients who had taken the 5-cog paradigm test were more likely to benefit from additional dementia care actions by a provider than the patients who hadn't taken the test. The researchers felt that those actions resulted in better diagnosis and treatment for patients whose condition may have otherwise been overlooked. /r/n/r/n. Cognitive impairment is common and a growing problem in older populations in the US and elsewhere. Joe Verghese MBBS, the study's senior author and a professor and director of the Saul Korey Department of Neurology at Albert Einstein College of Medicine, told Verywell Yet over half of dementia cases are not diagnosed in primary care, which is at the front line of this epidemic. /r/n/r/n. Given those numbers, Verghese said that there is a great need to improve how older individuals with cognitive concerns are detected and managed in primary care, and that this is the impetus to develop the 5-cog paradigm. /r/n/r/n. The promise of the 5-cog paradigm test is that it's quick and picture-based, so it can accommodate patients with lower education levels and language barriers. The memory impairment screening only takes 5 minutes and can easily be administered by any healthcare professional. The results can be shared with a patient's primary provider to follow up on diagnosis and next steps. /r/n/r/n. The 3 screenings that make up the 5-cog paradigm test are /r/n/r/n. If a patient scores positive on any of the tests, they are flagged in the EMR for provider follow-up. Providers are also given access to a decision tree that outlines what could come next for patients, which could include /r/n/r/n. Unlike many cognitive screening tests, the 5-cog accounts for cultural differences as well as low education, said Verghese. While there are many other cognitive screening tests, most do not provide guidance to primary care physicians on the next steps following normal or abnormal test results. /r/n/r/n. Dementia affects over 50 million people around the world, but that number is set to triple by 2050. However, since the genetics and risk factors for neurodegenerative diseases are not well understood, the U.S. Preventive Services Task Force has found that the evidence is insufficient to assess the balance of benefits and harms of screening for cognitive impairment in older adults. And researchers think that lack of guidance has led to about 2/3 of people with dementia being misdiagnosed. /r/n/r/n. According to a survey from the University of California, San Francisco, only 20% of primary care providers felt confident interpreting cognitive test results, and only 21% felt confident that they correctly recognized when a patient had a neurocognitive disorder. /r/n/r/n. A simplified cognitive test, such as the 5-cog paradigm embedded into an EMR that comes with a decision tree, could help providers feel more confident about taking action steps with older patients who have concerns about cognitive impairment. /r/n/r/n. Primary care is the right place to start in regards to cognitive impairment screening. Victor Henderson, MD, professor of epidemiology and population health, and neurology at Stanford Health Care, told Verywell. While it doesn't mean they will come up with the same answer as a specialist, they are positioned to make an initial evaluation and a suspected diagnosis. It is the best first step, regardless of what insurance you have. /r/n/r/n Routine screening for cognitive impairment is not recommended at a certain age, so it is important to let your provider know if you are having any symptoms. They'll be able to administer a screening test, like the 5-cog paradigm, and help guide you about the next steps in diagnosis and treatment, like getting a referral to a specialist. /r/n/r/n Everyone should know the 10 warning signs of Alzheimer's. That way, you may be better able to recognize them in yourself or a loved one. /r/n/r/n If you're worried about developing cognitive impairment in your later years, know that some mild cognitive changes as you get older are normal, things like subtle declines in memory, thinking, and reasoning. The key is that these changes should not affect your quality of life or core personality. /r/n/r/n If you or a family think that what's going on is more than typical signs of aging, make an appointment with your primary care provider to discuss the symptoms. /r/n/r/n If you or a loved one is showing signs of dementia or cognitive decline that is starting to affect daily living and quality of life, make an appointment with the primary care provider. They can use tools to screen for dementia symptoms and make a plan for care and treatment. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.